Today we are going to talk about an important event that occurs in the calendar of nephrologists, that is World Kidney Day. It's usually celebrated on the first Thursday of March. This is a social awareness campaign to create awareness about one's kidneys and to tell the public and policymakers, healthcare workers and patients alike about the importance of one's kidneys and also how to protect their kidneys and also living well with kidney disease. So this is a initiative drawn by International Society of Nephrology and International Federations of Kidney Foundations. They brought up together this initiative about celebrating one day to create awareness about kidney health. In continuation, this year the slogan for this year is Kidney Health for All, preparing for the unprepared and supporting the vulnerable. So what does it mean? That means we all know we went through a terrible time last couple of years in terms of the pandemic, the COVID-19 pandemic, where all services were disrupted, including healthcare services. In many countries, they could not have access to healthcare because of lockdowns and also supply chain disruptions and also non-availability of staff, because most of the staff were taken to COVID duties. So the essential services were maintained, but some of them really lacked, especially the non-communicable disease section. They were not followed up properly. They lost follow-up. So in recognizing this, the World Kidney Day, that is organization, came up with this slogan to help prepare people to get prepared, especially the vulnerable group, the patients with kidney disease, the elderly group as well as children, how to prepare them better for the unexpected events. It could be a pandemic like this or natural calamities like earthquakes, unforeseen events, tsunamis that could affect them. So how do you prepare? How do you prepare for unexpected? That's the question. So unexpected could be anything. For patients with kidney disease, what we suggest is at least they should know, they should be aware about their condition. So we ask them to prepare a diary, a medication diary, a health diary for that matter, where they can elaborate their health conditions and also the medications that they are taking, keep it handy, and also a stockpile of medicines that they regularly take. Some of our CKD patients as well as transplant patients, we encourage them to keep a stockpile of 1 month of medicines with them, so that they know when it's getting finished they can refill it and maintain a constant supply chain of the medications. Other aspects is obviously you should know whom to contact in case of emergency. You should have contact numbers of people, either your local clinic or the nearest healthcare center that you can go, or the physicians or the doctors or the dialysis unit for a dialysis patient. We give them their numbers so that they are aware whom to contact in case of emergencies. So this is one way of preparing the patients. The other one is to make NCD part of the screening in preventive medicine. In the sense, when you screen, every contact point should be used for patients to screen and get to know their health status. For example, patient comes for some other disease. If you can use that opportunity to check his weight, height, blood pressure, and try to tell him if he is obese to lose weight, incorporate healthy practices like eating healthy, drinking enough water, at least 8 glasses of water, 2 liters of water a day. This helps in motivating patients to understand what the disease process is, and also if they are hypertensive, they should know what medicines they are taking, they should know the level of kidney function that they have, and also about glycemic control in diabetic patients. Patients with diabetes, they should be strict on their diet as well as control their blood sugar levels. The most common cause in adults for kidney disease is diabetes and hypertension. It constitutes more than 2/3 of the patients. with kidney failure. So if you can control the diabetes as well as control your high blood pressure, continue your medications, avoid nephrotoxic drugs. Avoid nephrotoxic drugs means most common is the non-steroidal anti-inflammatory agents, the painkillers that they buy it over the counter. You need to avoid those medicines. Incorporate healthy practices, stop smoking, limit your drinking habits, as well as drink enough water. These, and drink healthy lifestyle, having enough vegetables, enough protein, limit the carbohydrates. These things will help prevent kidney disease and also protect the kidneys for longer term. Who already have kidney failure, if they incorporate healthy lifestyle, they can live well with kidney disease for a longer time. So with this, I think we are going to have some activities scheduled on World Kidney Day just to create awareness, especially in the public. We also have some activities for healthcare workers in the healthcare agency, and we'll be doing some mass gatherings for our patients on dialysis. We hope everybody takes care of the kidneys and stay healthy and well as long as possible. Thank you.